What's up, everyone? Sunny here, along with all my friends from the Be Kind crew. I want to welcome you to Connect2STEM TV in partnership with Cox Communications and the Arizona SciTech Festival. That's right, you are about to enter the wonderful world of STEM, where you can learn, discover, and have fun. So let's go!
Welcome to the Connect2STEM Online presented by the University of Arizona Health and Sciences. My name is Carly Flater, and I am a student at Arizona School for the Arts. Thank you for joining us. Our guest today is Kalisha Kelly, the Associate Director of the General Surgery Department at Banner Desert Medical Center. She is the loving wife of Justin Kelly, and together they have 4 incredible children: Cameron, 11, Justin II, 10, Audrey, 9, and Jason, 8. Kalisha is a California-born and Las Vegas-raised RN who made Arizona her home in July of 2019. Kalisha is a first-generation college student and received her Master of Science in Nursing with an emphasis in leadership from Grand Canyon University in 2017. Her Bachelor's of Science in Healthcare Administration was received from the University of Nevada, Las Vegas in 2009, and her associate degree in nursing from the Community College of Southern Nevada. Welcome, Kalisha.
Thank you, Carly. Thank you for having me. It's so good to be here.
Perfect. So with your help and guidance, we are going to discover the wonders of nursing and leadership.
Awesome.
Let's get started. So Kalisha, will you please tell us a little bit about yourself?
Oh, you did such a good job with that introduction. I don't know if I have any more to say. I'm just really excited to be here. I love what I do. Like you said, I am the Associate Director over at 3B. It's our general surgery floor over at Banner Desert. Banner is an amazing facility to work for. We have tons. We're probably the #1 healthcare provider in the state of Arizona. That's a big deal in itself when it comes to healthcare fields and occupations and thinking of things like employers to work for. Lots of great things happening at Banner.
That's so cool. What inspired you to go into nursing?
Believe it or not, to go into nursing, my grandmother got sick. She was 86 years old and she lived on her own forever, was walking to the grocery store, picking up her things. And then one day she had some stomach pain. She went to a hospital and she had a bowel obstruction. She ended up having to stay in the ICU overnight. And she just never came off of the tube. It's an intubation. She never came off the ET tube and essentially just died of acute respiratory failure. So that really just inspired me because I felt like maybe some things could have been done a little differently, to be honest with you. And I said I wanted to be someone in the room to make the decision and to fight for the patients. So her pulse ox was reading 91. They wanted her to be 98 to 100 before they took her off. And I kind of felt we could have done some things a little bit better. So that's what actually made me go into nursing, because I used to work in hotel administration, believe it or not.
That's really inspiring. So how would you describe your role now that you are a nurse?
Absolutely. So I don't work at the bedside anymore. I used to be an ICU nurse. So I love that. And like I said, my grandmother's story is what got me there. So I don't work with that population anymore. I work with surgical patients. So on this side, I have the opportunity, really my patients are my team. They're the nurses and the aides that are here. So I take it as a personal goal to help them get where they want to be in life. So many times I'll get a new grad who comes out of nursing school, kind of doesn't know what they want to do. And I help them navigate their career paths and help set them up with extra training or courses to take, which Banner pays for and offers to help them get where they'd like to be. So if ICU is your thing as a nurse, if it's ER, if you want to continue to work here at MedSurg Bedside, I help you grow into leadership roles. So I really love what I do here. So that's the fun part of my job. But I also do the finances for the floor. I make sure we're being fiscally responsible, that our patient satisfaction is good, that our patients are happy and receiving their care. And I work with some amazing physicians here.
That's so cool. And what is your favorite part about being a nurse?
I think you can pick a day and it changes, to be honest with you. But I think my favorite part is watching the interaction between the nurses and the patients and them really making those connections and the compassionate care that they provide. And we have an app over at Banner Desert called Cypher Rounding. So I round on the patients utilizing that app. and they'll go ahead and tell me how amazing the nurse was and how they feel like their family and how they're really grateful that if they had to be in the hospital, they're here, and how it was such a good stay. So that is really what warms my heart.
I like that. And what does it mean to be a nurse in leadership?
Oh, to be a nurse in leadership. I think the nurses at the bedside, let me just say this, they make the difference. They are the difference makers. They're the ones who put in the hard work. They've taken care of COVID patients. They've been through it all. But I think as the leaders behind the scene, we get to help make sure that they have all the things they need to do their jobs. As the leaders, we're here to give them the encouragement to keep working, to help them make a work-life balance with their families so they can take care of themselves, to come to work, to be their best selves, to be honest. So I think being a leader in nursing is multidimensional. You wear different hats. Sometimes you're the mom, sometimes you're the aunt, sometimes you're the leader. You get to do it all, which is pretty cool.
And nurses have recently really been in the spotlight. So what advice do you have for someone maybe my age or younger who is thinking about becoming a nurse?
Absolutely. I'd say do it. Now is the time. I know it probably was scary, and I'll tell you, for our nurses here, I'm sure they never thought that they'd live and be working during a pandemic, but we need you. We need you. Our patients need you. You will have such an exciting career. There are so many things you can do in nursing. You can be a leader. You can be a bedside nurse. You could be a nurse educator. You could do it all. Believe it or not, nurses work everywhere. You know, there's a nurse that works at Disneyland. Pretty nifty. NASCAR, wherever you want to go, nurses are there.
That's really cool. I did not know that there was a nurse at Disney. We are almost out of time. Is there anything else that you would like to share?
If I could say one thing, I'd say make Banner your home. If you're looking into nursing, come on over to Banner. We love new grads. We have an amazing new grad program. We have great leaders who would love to help you grow. We have phenomenal team members, and this is where you want to be, on the forefront of everything. Best company ever.
Thank you so much for being a healthcare hero and for inspiring so many people. We also want to say a special thanks to our sponsors, Cox Communications and the AZ SciTech Institute. Stay tuned to this channel for more Connect2STEM online. Bye.
Bye. Thanks, Carly. Have a good day.